Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to all.
In the February issue of the journal, we provide insight into the global epidemiology and psychosocial impact of psoriasis. We also discuss the role of tissue-resident memory T cells in disease recurrence and evaluate the effectiveness of tildrakizumab in treating difficult areas in psoriasis. Regarding atopic dermatitis research, we discuss a novel framework that integrates social determinants of health, emphasizing systemic inequities over biological factors. We also present a meta-analysis identifying a strong bidirectional link between atopic dermatitis and prurigo nodularis, highlighting shared pathophysiological mechanisms and potential therapeutic opportunities.
Pileski and Chovatia's review brings a fresh perspective to atopic dermatitis research. AD is a prevalent chronic inflammatory skin disease with a substantial global burden and negative impact on quality of life. While genetics and pathophysiology are key to understanding AD, emerging evidence indicates that social and structural determinants of health strongly influence the condition's onset, severity, and outcomes. Social determinants, such as economic stability, education quality and access, healthcare quality and access, neighborhood environment in social or community context, shape individual risk and disease experience. Structural determinants, including government processes, economic policies, social public policies, and cultural societal values, further act as upstream forces that directly and indirectly influence AD outcomes. In this review, the authors synthesize current knowledge on the impacts of social and structural determinants of health on AD incidence, severity, and disparities. According to the authors, embracing a biopsychosocial model is crucial to elucidate the etiology, epidemiology, and optimal management of AD.
Moving on to imaging techniques in dermatology, Bustani et al. Present a systematic review on tumor margin detection in basal cell carcinoma. Mohs micrographic surgery is the gold standard for removing basal cell carcinomas due to its ability to guarantee 100% margin evaluation through frozen section histopathology, offering the highest cure rate among current treatments. However, non-invasive imaging technologies have emerged as promising alternatives to clinical assessment for defining presurgical margins. This systematic scoping review examines the efficacy of these imaging modalities, focusing on those approved for clinical use by the United States Food and Drug Administration or the European Medicines Agency. A systematic search of Embase, Scopus, PubMed, and the Cochrane Public Library databases identified 11 relevant studies out of 2,123 records, encompassing 644 lesions across 5 imaging techniques. The findings suggest that dermoscopy, high-frequency ultrasound, optical coherence tomography, line-field optical coherence tomography, and reflectance confocal microscopy show potential in detecting basal cell carcinoma margins, which could enhance MMS by providing better preoperative planning, informing patients of expected defect size, aiding in reconstruction decisions, and reducing overall procedure costs. This review discusses the benefits and limitations of each technique, offering insights into how these innovations could influence the future of basal cell carcinoma management. Emerging imaging techniques could enhance MMS by improving margin assessment and reducing costs. Their adoption will depend on price and ease of use.
Another noteworthy article in this month's issue is by Barbosa da Silva et al., Exploring Life with Psoriasis in Brazil. This condition significantly impacts patients, yet data is scarce. The authors surveyed 563 adults with psoriasis between May 2022 and January 2023, analyzing disease severity, quality of life, and capability. Findings revealed a mean quality of life score of 0.59 and capability score of 0.71, with 80% experiencing pain, discomfort, and 86% reporting anxiety or depression. Higher disease severity correlated with lower quality of life and capability. Key predictors of poorer outcomes included frequent flares, comorbidities, female gender, Black ethnicity, and unemployment. Patients highlighted social stigma, powerlessness, and challenges in accessing care. The study underscores the urgent need for better awareness and access to treatment to improve the lives of people with psoriasis in Brazil.
IJD's February issue also includes an original article by Watanabe et al. On chronic spontaneous urticaria, or CSU. CSU exhibits notable responsiveness to omalizumab. The prognosis and subsequent therapeutic strategies warrant comprehensive exploration in cases exhibiting inadequate responses to omalizumab. The authors conducted a multi-center retrospective analysis to investigate the 12-month prognosis of patients inadequately responding to 3 injections of omalizumab. The endpoints encompassed identifying predictive factors for a favorable prognosis and assessing interventions related to an ameliorated prognostic outlook. The study involved 48 patients who met the inclusion criteria. After 3 omalizumab administrations, therapeutic interventions included the continuation of omalizumab in 34 patients, systemic corticosteroids in 7 patients, and immunosuppressants in 12 patients. After 12 months, 28 of the 48 patients exhibited a good prognosis, whereas the remaining 20 displayed a less favorable prognosis. Good prognostic determinants encompassed a duration of CSU within 51 weeks, the presence of angioedema, immunoglobulin E levels less than or equal to 100 IU per milliliter pre-omalizumab, blood eosinophil counts greater than or equal to 100 per cubic millimeter post-omalizumab, and urticaria control test scores greater than or equal to 5 pre-omalizumab and greater than or equal to 6 post-omalizumab. Following the 3rd omalizumab injection, the implementation of immunosuppressants presented an association with a good prognosis, while the employment of systemic corticosteroids correlated with an unfavorable prognosis. More than half of patients inadequately responding to omalizumab achieved a good prognosis 12 months later. Several clinical variables appear to be predictive of prognosis, and certain therapeutic agents can be associated with prognostic outcomes.
This month's last highlight is a short communication by Gandarillas et al. On bullous pemphigoid. Melanoma, with increasing annual incidence worldwide, is one of the deadliest cutaneous malignancies often treated with immunotherapy, which has led to commonly encountered immune-related adverse events, including bullous pemphigoid or BP. The relation between an individual's HLA inheritance and risk in development of BP is well studied. The development of BP as an immune-related adverse event in melanoma patients receiving immunotherapy is also well reported and considered to be related to the expression of BP 180 in malignant melanoma. The association of the enriched presence of certain HLA alleles and haplotypes that increase the risk of developing BP as an adverse event has been investigated in 7 cutaneous cancer patients who presented with immunotherapy-associated BP, diagnosed by skin biopsy and positive serology for anti-B P180 autoantibody. Their HLA typing revealed an enriched presence of certain BP-related HLA alleles, which was present in all 7 patients, whilst its occurrence in the general population is very low. Additionally, some patients had more than one allele, whereas a few patients had the whole haplotype of BP-related HLA. According to the authors, not only can such enriched presence be considered a role in risk stratification to initiate or continue immunotherapy, but it may also shed light on existing disease genotypes that can become unmasked to phenotypic clinically presenting BP due to immunotherapy rather than just a random adverse event.
With this, we have come to the end of this month's episode of IJD in Focus. Thank you for listening. Until next time.